importantly, we for the first time looked at subsequent therapy with a taxane. So many men face a dilemma in the second-line setting of whether they should pursue a second-generation AR inhibitor or pursue a taxane chemotherapy. As you know, many patients do not wish to receive a taxane because of the side effects, even though it may be more beneficial for many of these patients. And having a biomarker that could help separate out patients who are more or less likely to respond to one of these therapies could be helpful. So we looked at AR-V7 as a predictive biomarker for taxane therapy. And just like our initial analysis, the final analysis confirmed that AR-V7 was a negative predictive biomarker for Abienza in the final follow-up, but was not a negative predictive biomarker for taxane chemotherapy, meaning that whether you had AR-V7 or not, patients had decent responses to either docetaxel or cabazitaxel in the second and third line setting. So basically, AR-V7 could be a helpful test if you have a patient who's on the fence about deciding between one or the other of these therapies to help guide that approach. I would say that being negative for AR-V7 does not guarantee response to these therapies. There's many other mechanisms of resistance.